today's event. The chairman for today's event is Professor Olusegun Alatise. Professor Olusegun has been a professor of surgery at the Faculty of Clinical Sciences, College of Health Sciences, Obafemi Awolowo University. He is also a consultant and general surgeon at the teaching hospital. His area of interest is in surgical oncology and gastroenterology. Professor Alatise co-founded the African Research Group for Oncology in 2013, and he has trained over 30 general surgeons, with many interested in surgical oncology. Ladies and gentlemen, please let us, with a standing ovation, have the chairman give his opening speech. Professor Olusegun.
Standing ovation, please.
Standing ovation, please. Please, it's not easy to call someone a chairman of an event, really. Because most times when we go for an event, it doesn't matter what the MC decides. Maybe before the chairman gives his speech, the MC may decide that he wants to go left or right. But if the chairman says, young man, stay in the middle, the MC has no choice. So please, again, a round of applause for the chairman, Professor Alatise. Thank you, sir.
Can you be seated? It's a singular honor to be here. I was called some few days ago by Dr. Muta that he wants me to be here. I decided to leave my busy schedule to be here for one purpose, because of the theme of this occasion. We are talking about key surgery in the management of cancer. Many people underestimate the role of surgery in the management of cancer generally. We talked about getting radiotherapy machine to Nigeria. There's a lot of discussion about that. We talked about getting oncologists to Nigeria so that they can do the needful. But many people have forgotten that in this part of the world, the bedrock of management of cancer is surgery. And unfortunately, many of those patients that are going through this surgery, majority of them don't come out of it for a number of reasons. I know we have an erudite speaker that will talk on management of enterocutaneous fistula, but I just want to quickly share my thoughts about what we should do as a nation if we want to ensure that cancer death is rare in Nigeria. I use that word rare with a sense of responsibility. Rare in Nigeria. RARE is an acronym, because I believe that if cancer deaths will reduce significantly, we need to follow that acronym religiously. One thing that we need to do if we want to improve cancer surgery in Africa or all over the world, we must work on the resources to use by the surgeon. And that's the first R. You see, surgeons in Nigeria work with virtually nothing, only their bare hands to work. Currently, I practice at Obafemi Awolowo University. Of course, I consult for a number of private hospitals. I don't have mine, but because of interest to help the big guys that sometimes, unfortunately, cannot even travel because of COVID-19, I divert to assist in those private centers. If you look at the resources to manage cancer, the equipment to manage those cancer, many of our teaching hospitals do not have it. By God's grace, I do a lot of liver surgery. In those days when we do liver surgery, we retract. We ask one surgeon, please hold the abdomen like this. Imagine somebody holding the abdomen for 2 hours. What do you expect? One of the first complications I had when I started doing surgery was because I had one resident to help me retract and pull the ureter away from my field. But the tired resident, while retracting, slept off and left the ureter along my path. And of course, the ureter was injured. By God's grace, because we know what to do, we could manage it. But assuming this happened in a center where they cannot manage it, that will have been a problem. In abroad, nobody will do that for hours. There are standard retractors that has to be used. As of today, no Nigerian hospital have one of that retractor. I have it because I got it donated by my research colleague that operates with me regularly at Obafemi Awolowo University. You can imagine such a simple thing. It's so simple but very expensive because that retractor costs about $30,000. And you know, when you multiply that by 620 or 610 or whichever the currency is now, it's not much for Nigeria, but how many will be able to give that? We have a lot of rich guys that are supposed to spend that money. I won't go into detail. One of the big guys died in Yola. I believe strongly that if that guy that died in Yola have established a very solid teaching hospital in his center, he must have had probably a cardiac event that could have been managed, and he will still be alive today. But everybody is interested in doing things. So if we must eradicate cancer, there must be resources to use. Surgeons are only operating with their bare hands, and they are managing with just their skill and their bare hands. There are gadgets that can be used to do this thing stresslessly, which are not available. The anesthesia is anesthesiology. You see, many patients that died of surgery, half of them actually didn't die of the surgery, but died of the process of putting them to sleep and waking them up. When a patient, if I operate a patient and the patient wake up one way, I know because of experience how that patient will end. I know how that patient will end. And those anesthesiologists, believe you me, we have qualified and trained one, but the material to use. When we started ERCP in Ife, I lost 4 of the first 200 cases that we did, and all of them died of anesthesia complication. And what we realized is that they were dying of a particular drug that we were using. All that will never have happened because the hospital, the company that supplied the drug will have been closed down, will have been shut down. And a lot of things will have been done that will have forestalled that after the first experience. But if you want to send somebody to query somebody, then the grandfather and the grandmother will start coming around that you don't know this person. He actually related to the father and the mother of your mother, one way or the other. And at the end of the day, sentiment will run into it and will not do the right thing. Majority of people that died of surgery actually died of the process of putting them to sleep and waking them up. Yesterday, I had to do a procedure in Lagos because I was called on emergency on my way to this place. And when I look at the person putting to sleep, I know he's making an error. I have to take over from him. Imagine a surgeon operating and also putting the patient to sleep and ensuring that the patient do the right thing. The anesthesiologist do the right thing. There's a lot of stress on us as a surgeon, and that's why the younger ones are running away from us. They don't want to be. Now, because I was round up quickly, the next R is enforcement of rule. Many rules are not being enforced, not only in medicine, everywhere in Nigeria. Believe you me, we have rules. If a patient has enterocutaneous fistula, there are rules to manage those things. But patient does not even know their rights. The doctor don't know their rights, and everything is upside down. If we are going to get our country to the best place that we want it to be, we must start enforcing the rules and ensure that every rules is followed to the letter. Without sentiment, especially two difficult sentiment that we use here, religious sentiment and tribal sentiment, we must make sure that we deal with that. The last E is education. Like the chair of this foundation said, we need to educate our patients. Many patients don't even know what their right is. I always tell the patient when they come to me, please demand from the doctor, this is what I want. Many patients know the name of their consultant, they did not see the consultant through their treatment, and nobody has question. Who is the consultant that is managing you? Residents, house officers are managing you. You don't ask question. Who is the first person that you're supposed to see? Is it not your consultant? So if your consultant is not seeing you, why shouldn't you ask question? But many patients are just satisfied. I've been seeing, they ask me to do tests. You come back again, they give you another test. I'm going to do another test. Why are you not asking questions? We need to educate our patients. They need to start demanding for their rights. They need to know what their right is in the first instance, and they need to demand for their rights. But far and beyond that, we need to educate our professionals, not only surgeons. We need to educate our professionals. I always say this. I finished my residency program in 2007. I thought I was one of the best in that category. But fortunately for me, I had the opportunity to go out by 2010, 2009 for a professional training. Believe you me, everything that I read, I believe that it was experimental, was what I saw that was being practiced on a daily basis. And I was wondering, what is the problem here? Everything that I read, that I know those things, but we felt that it's not real. They are just using it on animal. Those were the things they were using in human, and to treat people to have better results. Assuming I don't have that opportunity, I will still be operating at the level I was. And believe you me, our training in Nigeria, I'm bold to say because I'm a professional, I've risen to the professorship, our training is still, there's a lot of lacuna that need to be covered. Our training is not adequate. Many people are doing what they know and not what they're supposed to do because they don't know. And the question is that who is to ensure that they are trained? Are they the one to pay? The training I went for in 2010, nobody sponsored me. I paid with my hard-earned salary that doesn't even come regularly. Many of us are training ourselves to train. That's why this part of the world, especially in Lagos, if you look for consultant in teaching hospital, you won't find them. You rather find them in private hospital, because I can't forget an issue that happened 2011. I was with a colleague from Lagos and we were discussing, and I said, this knowledge, I'm going to make sure that we use it in the teaching hospital. The guy responded immediately and said, this knowledge is not for, I won't mention the hospital, it's not for that hospital, it's for my private, because they did not train me. And it was difficult for me to convince otherwise. It was difficult. So we must encourage our people to train. But there is a problem too. When you train them, they don't even come back. They don't even come back. On Monday, I went to the theater. My best nurse, the best nurse that worked with me, I just discovered that she has traveled out of the country. The best hand we have, we don't know what is a major crisis. The best doctors we are training, they are not staying. The best nurses that we have, they are no longer here. The best physiotherapists that we have, they've all emigrated. The best pharmacists that we have, they are not in this country. And it's like a time bomb that is likely going to explode. All of us travel out of the country. Those big guys travel out of the country to go and meet those guys that are supposed to have stayed here. So it's a big problem, because all our best hand, a young colleague of mine said, why are you still in this country? I said, I don't even know, because I have opportunity to actually go. I've been offered job, but I don't know what I will be doing there. I just don't know what I will be doing there. I would rather love to treat my people rather to be one of the commoners over there. Thank you. I would rather be giving those resources, those skills to my people and be appreciated, than just be one of those doctors, because you are just going to be one of so many that you will not be able to make achievement. But with the little you are doing here, everybody will say, just go and meet that doctor. So, but how many the junior ones will think that way? Many are, and it's not their fault. They are thinking of their family, they are thinking of their children. My salary as a professor cannot pay. If I have a secondary school student in Lagos, in good private hospital, my salary as a professor cannot pay their school fees. My salary as a professor cannot pay the school fees of my child in a good private hospital in Lagos. So what do you expect me to do if I have opportunity to go out and to train my children very well? So there's a lot of problem why we are not getting it right. And those are the things that I just feel that I should not mention all this. There is a lot of lacuna, there is a training gap, there is educational gap, there is a lot of problem with anesthesiology, there is resource gap, both for the patient and also the doctors. Patient, I have patients. Last Monday I had to pay 70,000 for the CT of a patient that has virtually nothing. And that is out of the salary that cannot pay the school fees of my daughter. You can imagine the pressure, but most of us that are in cancer ward, there's no way you will not be emotional when you see some patients. It pains our hearts when we see some complication, but most of those things are not intentional. You are doing what you know best to do, but that may not be the best because you don't have appropriate resources and you don't even have the technical know-how to do the best. I won't go further than this, but to say that we are here for a good time, I want us to be an advocate. I want to encourage all of us to be an advocate. Advocate for good quality of treatment, advocate for government funding the treatment, and more importantly, you take care of yourself. Colorectal cancer and cervical cancer, including prostate cancer, are preventable cancers if you do the needful. Being a researcher in the world of colorectal cancer, I don't talk anywhere without telling those people that are above 50 in the house, that have not done colonoscopy, that you are not helping yourself. You don't like yourself. Colorectal cancer arises on the backbone of polyp. And if you can do colonoscopy and remove that polyp, you will not develop that cancer. But many of us don't even know about it. And many of us don't avail ourselves. Colonoscopy is available in Nigeria. There are other screening modalities that are free of charge, that are not very expensive, that is affordable. In fact, last year or 2 years ago, we launched FIT trial and we screened about 600 people free of charge. Take advantage of those screening programs and get yourself free of cancer. God bless you.
Thank you very much, Mr. Chairman, Professor Alatise. Once the chairman was giving his speech, he was saying as a professor what he earns. We find some difficulty in paying his total school fees. And I asked myself, for you to become a professor, you must have your first degree, you must have your master's, and then you must do your PhD, you must do your doctorate. I'm just here, I only have my first degree. The professor cannot pay for secondary school by myself. I have nothing to do. All right, thank you very much.
Alright, we're taking goodwill messages now, and we're just going to do that very quickly so that we can go into our keynote, what our keynote speaker has for us today. So please, we have two people here to give us goodwill messages, one online and one of them is present here. Please, let's give a round of applause for Mr. Yinka Adebi.
Good morning, everyone. All protocols observed. Well, I want to thank the planners as well as the initiators of this program. Within the short few minutes that I've been here, I think I've learned so much. I'm representing our class, and Mrs. Anjori, I'm sorry. I'm used to Yinka Adejoyi. We are all classmates, not just schoolmates. And I'm happy that something like this is being put together to remember her. I think it's a very, very worthy program that I would also that also matches the nature of the person that Yinka was. I don't want to take too much of our time, but just as the chairman has said, I think he can take me to be one of the disciples now. He's gotten a convict already, because I'm quite guilty of a lot of things that he mentioned. I do joke with friends because it's reality. When you are driving your car and there's a light that comes up, immediately you go for checkup. You send it to the mechanic. But you go on year without even having a comprehensive medical checkup. And it means that you actually pay more attention to your car than to yourself. When there's a headache, it's also like a sign. What do? You just look for an adjacent without trying to find out what the issue is. Whereas a caution light on your car, you send it to the mechanic. Interestingly, you can also get some of the charges for these cars these days, just to go to the mechanic workshop and come back. It's actually cheaper than some of the tests that you can actually carry on yourself. So, thank you. I want to thank everybody for being here. It's a big effort because yesterday I wasn't sure of how to make it because I didn't have fuel. Today I woke up, it was heavy rain, but I said whatever it is, I want to be here. So I'm really happy that I'm here, and I want every one of us to congratulate ourselves for even being here, because it's only when we are here that we can get. Thank you. Thank you very much.
Thank you very much, Mr. Yinka Adebi. Ladies and gentlemen, may we now make welcome to the high table one person who just entered. He is the global president of St. Charles Old Boys Association. Please, a round of applause for Mr. Peter Tade Adekunle. Mr. Peter Tade Adekunle, global president, St. Charles Old Boys Association. Thank you very much for coming. Sir, Mr. Peter Adekunle, we understand you're just coming in, but very quickly you're also scheduled for a goodwill message, so we'd like to hear from you, sir. Thank you.
Thank you very much. Good morning, brothers and sisters, distinguished ladies and gentlemen. Well, on behalf of St. Charles Grammar School Old Boys, of which Mr. Olusegun happens to be a very strong member, one of the earliest members of St. Charles Grammar School, Osogbo, we quite appreciate this kind of program, which is an educative and enlightening program to sensitize the general public on the issue of cancer. They cannot talk enough about it. And from St. Charles Grammar School, Osogbo, we say congratulations once again for putting this foundation together and for this kind of program. I will pray the good Lord will continue to sustain you and sustain the foundation. Thank you very much.
A man of little words, very brief and concise. Thank you very much, sir, for that good old message. We have someone that will be communicating to us online for a goodwill message, and he is the President CEO Nigerian Cancer Society. Please let's welcome Dr. Adamu Akasan Umar.